Thank you, Krista.
You're welcome.
As far as the public notice, should we just do the public notice then for both meetings, or do you want to do nutrition separately?
Nutrition can go first, but I think we can do the public notice.
Okay.
Yeah.
Good afternoon, everybody. There's a public meeting and notice is given for the Dunn County Aging Disability Resource Center Advisory Committee and the Nutrition Advisory Committee meeting. And let's do a roll call before we go into either one of them, so we know who's here. And the best way to roll call is to just speak your name and Tracy, because I don't have a list of. You all look familiar to me, but you know the names. I know Betty for a long time, right, Betty? Okay.
Heather Jerry, community member.
Okay.
Margaret Hagan, Carol Kagan,
I'm Larry Bjork, Chair.
Luke Wilsey, Vice Chair.
Suzanne Gaines, and Bart.
And Bernie Allen.
And Tracy Fisher from the ADRC. Just as a reminder, these are the folks that are on the Nutrition Council Advisory. So the first part of the meeting is the nutrition. It's Larry, Maria Bukowski, who's not here, myself, Suzanne Gaines, Sherry Homestead, who's not here at this point, Carol Kadinger, Gary Steen, who isn't here, and Betty Zimi, who is here by Zoom.
Okay, thank you. Let's just, is there minutes to approve for the nutrition here from, that would have been way back, September 19th. And Paula called that meeting to order. I don't believe I was here that
Correct.
day. And anybody have any comments about the minutes for the September 19th meeting? And I entertain a motion then to approve if there's no questions. Motion to approve the nutrition minutes.
Gaines moves to approve the nutrition minutes from September 19th.
A second, please. Number second. Okay, all in favor signify by saying aye.
Aye.
I know we got some public comments coming up for the ADRC committee. Is there any public comments as far as nutrition advisory meeting? Okay. So then I guess we could just go right into report, and I guess it'd be Bernie.
Yes. Thanks, Larry.
And by the way, Bernie, yours looks better and more professional. I'm kind of going for the distinguished look myself.
Looks good. All right, yeah. So my name is Bernie Allen and I'm the nutrition program coordinator. Excuse me, and I'll go through just some program updates and things that have been taking place in the last few months, you know, in regards to the nutrition program. So at the last meeting, we were kind of in the process of learning that the O'Galley meal site in O'Galley, the town of O'Galley, sold their civic center. And that has now taken place. So we don't have a program there currently. They are going to be building another civic center sometime this year. They're going to break ground in the spring and then we'll have to reevaluate at that time. Some of the participants that were having meals, receiving meals there at the meal site are now enrolled in the home delivered meal program, at least for the time being. Some other updates that have taken place, excuse me, back in December, we had a couple of different events that occurred. One of those was a presentation by Carrie McKnight, who's our consulting dietitian, and she's actually an employee of the Neighbors of Dunn County. And she helps us on the backside as far as review and approval of the menus that we use for the program. She did a presentation in Colfax to the participant diners there, the program participants, just talking about healthy holiday eating and just healthy eating in general. That was back in December. There was some different parties and get-togethers that took place around the holidays. In Menominee at the Tantera meal site, we had a small kind of Christmas program, and we had participants attend and some of our volunteer drivers. And then the Colfax site had a kind of a volunteer brunch on January 6th, which is a Friday where the site's closed. So instead of having the normal meal, the site manager prepared a meal, a breakfast brunch, and we all ate together and had a nice time to visit. One of the other updates that I neglected to add to this agenda, last 2 years now, the Feed My People Food Bank has donated what they referred to as blizzard bags to our program. So basically it's like a bag that has shelf stable food that can be utilized in times of inclement weather. Obviously that we missed a few dates on that, but now we have those and we are distributing those for people that prefer to have that on hand. Some declined because they're not interested in what's in the bags. But this year I've taken a look and it's soups, some granola bars, what else was in there? Just a variety of things that people can have on hand that doesn't need to be refrigerated and shelf stable. So we'll get those out, and they're designed again for days where we are closed due to the weather, or just for people to have on hand, and for some are higher need, they may want more than one, and that we can usually accommodate too, just to make sure they have some food on hand. Then I put together just a few of the numbers as far as the people that we're serving in our program. Obviously, we just concluded 2022. And so in 2022, we served a total of 35,948 meals. The majority of those, of course, were home delivered. That's kind of where we see the most demand, the most interest, and the most need, and that was 26,535 meals. And then the other portion is congregate dining, so that's where people are eating at one of our sites, whether that be a restaurant site or a site where they're coming to, like for example, the Colfax Grapevine Senior Center. And last year that was 9,413 meals were served in that capacity. And then I included just some of the data from the last 2 years as far as the total meals. So if you go back to 2021, our total meals were 25,299. And then in 2020, kind of during the height of the pandemic, we served 36,948 meals. So you can kind of see that it's been fairly consistent. Last year was 2021 was a little bit lower, but we've kind of picked back up again in 2022. Some of that could be related to, the population aging. Also with the cost of food and meals, more people are looking for ways that they can, save money. So some of our restaurant sites that were kind of slower during the pandemic, especially Ridgeland, there's a Dairyland Cafe that we partner with, and our seniors can come in and have a specific senior meal and have it for $5, suggested donation amount of $5. So that's a good way for them to get a meal and not have to pay a full restaurant price and still have a good healthy meal. So on the lower portion there, we are still always kind of recruiting or attempting to recruit volunteers. It's kind of slowed down, I'll say, in the last few months. Obviously the winter and the weather hasn't helped, but we've done some advertising, and Tracy's done some generalized advertising for volunteers for the ADRC, whether it be for our program or just for driving people to appointments. It's kind of a nationwide concern. Luckily, we've been able to kind of get by on the volunteers. We have a pretty good core group, a nationwide concern as far as recruiting volunteers, I should say. So we are starting to see some of that where it's just a trickle of interest here and there, and there's some people that maybe are able to drive every once in a while and deliver. So yeah, we're hoping maybe, I don't know, maybe spring will be a better time, but I also did contact some of the local businesses recently, and we're kind of on the list of, so their employees, like for example, Wisconsin Credit Union, they have a list, and if the employees want to donate their time in some facet, they can look at the options, and we're one of the options. And same thing with house calls in Menominee. They encourage their employees to volunteer, and we're again on their list as far as a local organization that they we can work with, or we can work with their employees, I should say. Sometime in 2022, we started offering the mileage reimbursement to our volunteer drivers, which is actually the IRS reimbursement. So it's kind of gone up, recently with additional costs. And I didn't write the number down, but I think it's 65 cents a mile or something like that. We have some people that utilize that. They basically all they have to do is submit a form and just say, here's the days I drove and the miles, and then we get that to our accounting department and pay them out just like we would any other vendor. It hasn't been, I haven't received a lot of forms, but it kind of, I think hopefully it helps, and it may help, people that wouldn't always consider volunteering because of the cost of fuel. But like I said, some people utilize it, but it's not an overwhelming amount of reimbursement that's taking place. So, but yeah, we continue to, reach all of our people. We still have the 3 routes in Menominee, getting out to Knapp, and then of course Colfax, and then our rural routes. So as you can see from the numbers, it's been pretty busy for us. So.
I'll mention it now. It could also part of the other committee meeting. Since our last meeting, Gary Steen was here. He was the county vice chair and head of our legislative committee, and it had been added to the county's legislative agenda to pursue, changing the law or for insurance for the drivers. If you're a volunteer driver, that some of them have been hammered with having to have big increases in their liability insurance or something, as would be the same as like an Uber driver. So, that could, so that has been a concern. So I would think that would be one of those bipartisan issues that could be discussed in Madison, to get legislations so that volunteer drivers for food programs don't have to pay a higher rate as if they were using their vehicle as a source of income. And there's a legislative agenda or legislator meeting, I guess, Monday, February 8th, that the county has. I think it's the 8th. It's a Monday. And usually then the legislators show up and the county has a chance to address their opinions on things, different things that they'd like to have done. And this is a really big one for some folks. So I get, if it affects Dunn County, it affects Madison and Superior just as well. So hopefully that's going to be a positive change.
Sure.
Anybody else got any?
Yeah, I have a question. Now, I understand that all of these meals are at lunchtime that we provide. Are they all at lunchtime?
Yes, the meals that we deliver, I mean, it's kind of can vary because sometimes we're delivering down, like in O'Galley area, it could be as early as 10:30.
Right, well, that's your goal then, midday.
Midday.
And now we have many churches in Menominee that serve an evening meal. Do you work with them at all? Coordinate or have any idea how many come to those meals?
Well, not necessarily. However, Bobette, who was in my role previously and still works for us at the Tantera meal site, she manages the Thursdays table. So I talked to her about it once in a while just to see how things are going. But I do have people that call my office who are, looking for different sources, and I would refer them to those, the 4 meals. I don't have it memorized, but I have the information available. But no, I otherwise, no, I don't really coordinate with them. But
I'm curious as to how many people actually go to these meals. I think quite a few people do.
I think so too, and it seems like they may actually, I think my understanding, like during the pandemic, it went way up and then it went kind of back down, and now it's kind of going back up again. But I don't know the actual numbers.
Okay.
I think it's challenging in some regards because they don't know either until they show up. But they kind of go on if they served a meal previously, because I think they post the meal on some social media, maybe Facebook a few days at least, so people can see. And sometimes if it's a popular meal, then it may be more interest on those days. But I think Thursday's table, last number she threw out was maybe 95. At some points, the highest might have been 135, but that's kind of, and that's at least Thursday's table that I'm aware of.
I think the Thursdays table, which is the one that our church does, has really varies, but, and I think they have gone up, because everything's they don't come to the meal anymore. It's all hand delivered
Yeah.
outside. And I think it has gone up as high as 150,
Oh,
but it also might go down to 100 or 90. So that's quite a few
That's
people. And
significant.
sometimes people will come and get 5 meals, to take with them because it's all takeout.
yeah.
And, anyway.
It sounds like the takeout option's more popular. They have more people that prefer to take out versus dine in. So I guess that's why they, for a while they weren't able to have people dine in, and now it sounds like it's just not desired. They did a survey apparently, and they wasn't a big interest in the dine in, so they just
St. Joseph's dine in.
okay.
There are there 4 churches
Yeah.
doing it? Tuesday, Wednesday, Thursday, Monday?
Yeah, I'm pretty sure Monday through Thursday.
Okay.
Yeah. Yeah, and each night is a different location.
Good discussion. Anything, other questions for Bernie or the meals
like-
program?
I'd like to know how many people were participating in O'Galley before you, and now that they're on home delivered meals, but how many, were there a lot of people down there that participated?
No, not really. I think prior to the shutdown due to COVID, they had anywhere from like 6 to 10 or 12 was kind of a big number for them. And it was only 2 days a week. It was
Yeah.
on Mondays and Wednesdays. But for a while there, we had a couple of our regular participants that just weren't able to participate, and so it could be like 6 people. I think 8 was kind of so it wasn't a lot of people.
Well,
No.
there was always a handicapped issue at O'Galley. and-
Yeah,
and they
yeah.
had to go downstairs and stuff like that. Does that mean that, when they start up again and have a new civic center, are you looking at maybe having something down there again?
Yes, the plan would be to first gauge what the interest level is, and the town board is making the decisions as far as the construction of the facility. I kind of let them know that for our part, we would need either a dishwasher or a 3-compartment sink to handle the dishes and things. And they hadn't made any final decisions on that. I kind of would hope or assume they would want to have some good functioning kitchen, but I think it was going to come down to the budget. But yeah, as long as, the building, I'm sure will be handicap accessible, obviously, but as long as they have a kitchen and we have interest, then it should be, very nice place to have it. It sounds like, but it's not terribly far from where the old one, it is. Somebody purchased it now. And I think they're going to turn it into either like a bed and breakfast or Airbnb or something like that. But yeah. So.
Okay, good.
Mhm.
Thank you. Anybody else? Well, if there's any more business with nutrition, we can just slide right into ADRC.
And just for Betty's purposes too, the next Nutrition Advisory Committee meeting will be held on is scheduled for Monday, May 15th, also at 1 o'clock. So.
Okay.
Just
Thank
for-
you very much, everybody. Have a good day.
Thank you, Betty.
Bye-bye.
Okay, with no other business, we'll then adjourn and just move right into the other committee. And now, last time when we met, we were also had the Transportation Coordination Committee,
Mhm.
right?
Yep.
Are we always the same with that too?
No, the
Okay.
Transportation Advisory Committee only meets that one time a year in
Oh,
November.
okay.
Yep, so that's the only time that they are
Okay.
present.
Okay. I'm glad I was here then.
Yeah.
Yeah. Yeah, and did everyone kind of find out how we got through the little hiccup?
This group isn't aware of the hiccup, Larry, so maybe
Okay.
you could describe to them, there was some confusion. It all ended up being just fine,
Yeah.
but there was some confusion.
Well, let's put it this way, when local government is trying to fund their programs with state money and there's a hiccup, everybody stops breathing for a minute.
Mhm.
And Supervisor Hagan was part of one of the committees, and he seconded the motion to go for
The grant.
the grant. And thank goodness Vice Chair Stein was sitting right next to me. So, I accepted the motion for a second but as it turned out, it was okay.
There was a concern for a minute.
And
there-
she was gone.
Yeah,
It's sort of like,
there were all sorts of emails flying about that I wasn't a part of. And then when I got put into them, I was kind of able to figure it out. But the concern at first, people thought that Supervisor Hagan was here just as a member of the public for interest's sake, and it was improper for him to second a motion to move forward with a grant. But and so then what was going to have to happen is I was probably going to have to contact the state and explain this issue and kind of hold up our application for the grant. But when I came back, I explained to Nick Ling, our corp counsel, no, Supervisor Hagan wasn't here as a member of the public. He was here as a part of the Transportation Committee meeting, which have always been held jointly. And then Nick got very involved and did lots of research to be sure that everything was handled correctly. And he said, yes. And I said, would you like me to do that differently in years to come? Because I just followed the example that I had from the year before. And he said, nope, everything, you can do things just as you had. But people were just concerned and being sure that we followed the correct procedure so that there weren't people that were approving things that didn't have the right to vote, basically.
Right.
But that was not the case when we had all the details.
right. So there's always something,
Yeah.
Thank goodness that we have staff that knows what to do. Go ahead.
I'm a little confused. So on what basis did he have a legitimate?
Because he was a member of the Transportation Committee meeting, and it was a joint meeting of the two groups.
He's not on the call of the roll and such.
Oh, well, see there, you found an error that I will correct. So,
Okay.
yes,
I will pencil him in
Yeah.
before I move that we approve those.
well, he's in there as Andrew Hagan.
Is he?
Yep, he's
Yeah.
on the, right next to,
Oh, I found it. Thank you.
yes.
Beg your pardon. Okay.
Yep, so there he is.
Just a reminder, if you can push the button on your microphone when you speak, we can't hear.
Sorry, thank you. Thank you, Krista.
Okay, well, we got through that. I thought we should at least mention it and thank Tracy for fixing the problem that was not a problem, but boy, it sure got Nick Lang
He
Corporate
got him
counsel go-
nervous.
nervous.
Yes,
Go ahead.
And excuse me again, but do we need to approve those minutes or not?
I think that was
Oh,
what,
yeah,
yes.
right. Okay, so I'd like a motion then to approve the November 20. Is that the November 21st meeting? Does it go back
Correct.
that far? Yes.
I move approval of the November 21st minutes of the Transportation Committee.
And a second? Second. Oop. Any other discussion on the motion? Then all in favor signify by saying aye. Aye. Opposed, same sign. Okay, motion carried. Okay, wow, rolling right along here. I get the right sheet of paper, where do we go next here? Oh, we're gonna go to any public comments for ADRC?
I have something. I wanted
Yes.
to mention.
And Margie, if you could push your button on your microphone, the one with the little person. Yep.
Okay, can you hear me?
Yeah, go ahead.
Okay, I'd just like to, since we deal with aging population, and I think that we also need to coordinate, and as you mentioned, coordinating with other things that are going on in the community, whether it's the food services that are available in the community, or educational opportunities or whatever that are available for older people. And I want to mention Chippewa Valley Learning and Retirement. And I think a number of you in this room know about this, but I think that that's something that people in the community that are not necessarily involved with the organization may want to know about it. This is the fall semester, and they're coming up with a spring and a winter and spring semester that will be sent out probably in the next few weeks. And people can pick up one of these brochures at either the library or the senior center. And I think it might be that you want to actually have some here at ADRC. Because I do think it's a way of making sure people get out and socialize and keep them become brain active, so that people are maintaining abilities and staying in touch with other people. And I just think it's a vital program in the community, that, and maybe even putting something in the newsletter, in the February newsletter, about the fact that, you know, things are available at the senior center and the library and the public libraries in the area, and both here in Eau Claire too. So,
And
okay.
I know, Margie, that we've publicized specific events put on by Chippewa Valley Learning and Retirement on our Facebook page. I'll check with Denise. It's very possible we've put things in the newsletter before, but we certainly can again, because it is a wonderful program.
Well, I think that the sign up is going to be the end of February,
Okay.
and then classes start in March. So March through the summer, and people can, you know, come to the sign up, or they can just pick up one of the brochures. Okay, that's all I wanted to mention.
Good.
Krista, do we have any public comment online or?
No, I did not receive any.
Thank you.
You're welcome.
Okay, no more public comments then from anybody or questions? We can just as the agenda talks about our upcoming meeting, at next time will be March 20th. And I assume it's 1 o'clock again here.
Yes, that is correct.
And boy, is that gonna be a nice day. Ice is all gonna be gone.
Okay,
You can park your car and not fall down.
Larry, we're gonna hold you to that.
Okay,
We're-
well,
Bernie's writing a note. He's saying
Right.
Larry is guaranteeing a nice day with no ice.
yeah, right.
We'll see how that works.
We
out
might
for
have to
us.
have special parking and then park your car for you and let you. Yeah. No, I doggone it. It's gonna be a
Positive
nice day.
thinking, positive
ready.
thinking.
I'm ready for a nice day. Okay. Next item is our staff report. Tracy, that would be
That would
the
be
Tracy
me.
staff report.
Yes. I have two things I kind of wanted to go over with the committee today. The first thing is a new grant that I've been part of applying for, and I'm quite excited about it. But by our next meeting in March, we'll know if we are successfully granted. And it's called the Independent Living Support Pilot. It is through the state of Wisconsin, and it's available only to ADRCs. So this grant is fairly unique, I think. The state made ADRCs aware of the opportunity in November, and then they had a webinar informational session in January. And what they're calling it the ILSP grant, what it provides, the way the state explained it to us is that they had some excess or remaining ARPA or what a lot of us would call COVID money left over from the federal government, money that they had received for COVID response type things that had not been expended for whatever reason. And the Bader, which is the state organization that oversees ADRCs, the Bureau for Aging and Disability Resources, went kind of to bat with the federal government and requested kind of an exemption for spending this money specifically on COVID type education and to use it in a different way. And what they requested is that the federal government give the state permission to develop this program in which folks who have needs that we recognize in the ADRC setting, but don't qualify for what we call our family care programs, would have some support. So let me kind of step back and explain that a little bit. A lot of folks come to the ADRC. We serve everyone, regardless of income, if you're an adult, 18 or older with a disability, or you're an elder with or without a disability, we serve everyone, we'll meet with everyone, we provide information and assistance and resources to everyone. But there is a program that is very popular that folks frequently think of when they think of the ADRC, and that's called the Family Care Program. And the Family Care Program is a program that has a couple of different qualifiers. So in order to be eligible for the Family Care Program, first, people have to be financially eligible. And that what it means is they have to be eligible for the Medicaid program. And in general, the general rule of thumb with the Medicaid program is that folks' personal cash assets have to be spent down to about $2,000. There are some, there are some variations with that, but that's just a general kind of rule of thumb. So people obviously have had to spend their own funds down to quite an extent. The second qualification for the family care program is a person has to have a certain level of what we call functional needs. So many of those functional needs are associated with activities of daily living, like they need help with dressing, or they need help with money management. They might have memory issues. Some people have very, significant impairments and need 24/7 supervision. So the two kind of legs of the family care program are they need to have financial need, and then they need to have that functional need where they need assistance with something in their daily lives. The issue that we see is that there are a number of people that frequently may have a few functional needs, or they may be struggling in certain areas, but they don't financially meet the requirements of that program, so they're not eligible for that. And that program is a wonderful program. It provides a lot of assistance to people in the community. The goal of that program is to keep people in as least a restrictive setting as possible. So if people's care needs can be met like in their home with home care, or at an assisted living rather than in a nursing home setting, that saves the state significant funds. So that family care program is really, really beneficial to those folks who qualify. But what everyone recognizes is that we meet with people every day that have needs, that are struggling to stay in their home for a certain, reason, but they don't financially meet that requirement of being eligible for Medicaid and having spent down those funds to $2,000. So this program, the ILSP program, will serve people who are up to 300% of the federal poverty level. And in Dunn County, that is actually quite a large number of our residents, especially those with disabilities or our elders. So a lot of people could become financially eligible for assistance that weren't eligible for the family care program. And they do still have to have a functional need, but the screening is a little less stringent than what would be required in terms of the family care program. For example, they kind of provided a draft screening that we'll do with folks. And one of the functional needs could be something as simple as like, I don't drive anymore. I have an issue with transportation. So that's not significant enough to qualify somebody for family care, but it could qualify them for this program. What this program will do for the people who are enrolled, it will provide them up to $7,200 of cash assistance to keep them in what the state refers to as least restrictive a setting as possible. So for most folks, that means wherever their home is now. So if they're living independently in their home, or if they're living in an assisted living or something like that, it'll provide up to $7,200. The grant is scheduled to be a 1-year grant period, so they have to spend that $7,200 in that 1-year grant period. And the state is being very flexible as to how folks can spend it. You know, we had all sorts of questions about ideas like, how about building a ramp into someone's home? Yes, that's allowable. How about a lift chair because they're having trouble getting, up and down out of their regular chair, but they can't afford to build a lift chair? Yes. How about paying for caregivers to come in and help with bathing and showers? Yes, that's allowable. So basically anything that we determine could help the person continue to be independent in the setting they're currently in would be approved under this program. So obviously this is really exciting. It's a really exciting opportunity. The state has up to 5,000 spots throughout the entire state. So 5,000 people will be allowed to participate in this grant. And the grant application that they gave was actually, it wasn't very complicated. They wanted it to be 5 pages or less. And they were just, each county had to come up with a number that they were requesting, a number of slots they were requesting. We did something kind of original, I think, and I think it will be attractive to the state in that we actually banded together with Chippewa County and Eau Claire County and submitted a regional application. There were a couple of reasons why we did that, but basically, the ADRC directors of Chippewa, Eau Claire, and Dunn County, we have a very, very strong working relationship already. And we recognize that our rural areas sometimes get skipped a little bit when it comes to these sorts of things. Honestly, Milwaukee County could probably take all 5,000 slots and fill them easily. So the state in general likes regional approaches to doing things because they see that as efficient and an efficient use of resources. We asked for 320 slots, and we based that number based on the staff that we're requesting, the cost of that staff, our overall population, our population that is elderly and disabled, and our population that is up to the 300% of the federal poverty level. We felt that that was a reasonable request for our region. So that application was submitted. It had to be submitted by the 13th. We submitted ours on the 9th, and I got the response that the state received that. Dunn County has agreed to be, or I have agreed to be, the lead agent for that, should we get it. Eau Claire and Chippewa County are both going through some transitions, especially with like their fiscal departments. They have a lot of retirements and a lot of hiring that it would be challenging for them to take on some of those roles. Paula, the DHS director, and myself, we connected with Chris Corpola, our finance department, HR, just to confirm that everybody was supportive of us going through with this project, and everybody was very supportive, even though it'll mean a little bit of extra work for everyone. Our grant, we asked for 2 full-time staff to serve the 3 counties, which we assume will also be attractive to the state because rather than each county asking for 1 worker, we believe that it's possible for 2 workers to serve those 3 counties adequately. So we are very hopeful. Again, I do think this is going to be an incredibly competitive grant. When we had the webinar, the informational webinar, there's 72 counties in Wisconsin and 11 tribes. So that's like 83 possible ADRCs participating, and there were over 100 participants in the webinar. So I think that lots of counties are going to apply, and it'll just be very interesting to see how it all shakes out. They did tell us we would know by the end of February. So by March, I'll have an update for this group. But I'm hopeful that our project might be unique enough and might catch the eye of the state funders. I think it'll be attractive. I do think that they'll want to spread, you know, kind of the slots around the state. They were very clear that they have a desire. They feel that this will be a very successful pilot, and if they will, that they will be making a strong push to continue this project and expand it if it is successful. So even if we are not granted, I will be watching this pilot with a lot of interest, because my hope will be that it will be very successful and then it would be expanded into further counties, and that even if we don't get this funding the first go around, it'll be a program that'll will open up to other counties in the future. And again, $7,200 isn't a huge amount of money, but it's enough money that can really provide a huge amount of assistance to people. And, you know, $7,200, while a substantial chunk, is quite a significantly less than even 1 month of a nursing home stay if the state were funding a nursing home stay for people. So I think if you can show that this is successful in keeping people safely in their own home environment, it could really have quite a bit of cost impact for the state and provide resources to folks that really, really need them. So I'm really excited about it. I'm really hopeful. I will be honest with this group. If we don't get it, I will be disappointed, but I'm still hopeful that even if we don't get it, like I said, I will continue to watch that pilot with interest, because I feel like it could be such an impactful program and so useful to so many of our citizens that I would just really hope that it's successful and something that expands. And, you know, many of our programs, ADRC started this way. They started as a pilot project within a few counties that then expanded. Our dementia care specialist positions started the same way. They started as a pilot project within a few counties that expanded and are now across the state. So this is the way the state tends to do this sort of thing. So I'm hopeful, and I will just keep this group updated as I'll have a big update in March, because we'll know if we're funded or not.
I have a question.
Sure.
What is the, you said 300% of poverty level?
Yes.
So what is the poverty level? And so that I just kind of want to figure out what.
So Margie, as soon as I said that, I realized I should have had that number for you, but I know I can look it up, because, hold on. So the federal poverty level for this year for an individual is $13,590. So 3 times that would be 300%. So it would be around 40,000 for an individual person.
Okay. Okay, that's helpful. I'm thinking in terms of, you know, even people in the support group that I'm involved in, they may be eligible for something like this.
Absolutely.
Whereas they aren't eligible for the family care program the way
Correct,
it is
because they're
now.
not quite to that. Yeah.
And so, okay, thank
Yep.
you.
Any other question? Yes.
I think you make a good presentation at that legislative committee meeting.
Oh,
Please.
well, Larry.
Well, I mean, you know,
Sign
let's say, you know, if you're gonna jump into this pot of boiling water, as far as trying to get money out of Milwaukee and Madison, you might as
Yes.
well get really wet.
You know, and I mean, I'm not saying that Milwaukee and Madison don't deserve the funding. Clearly those
I
are
can say
huge,
that.
huge. Yes.
Say that.
I'm not going to say that, but Larry could say, but because, you know, obviously those are huge pockets of need and population. But that's truly why Dunn, Eau Claire, and Chippewa County, the 3 of us came together, because we really want to be competitive and we feel like this will help us be competitive. Having Eau Claire County as part of the mix is also helpful, because their population is higher than Chippewa and Dunn together. So Leslie from Chippewa County and Linda from Eau Claire County are much more experienced ADRC managers than I, and they've been part of some quite successful grants in the recent history. And they felt like this would really make us more marketable for this grant. So, and then they pulled me along because I don't know if I should say the dummy, but I was the one saying, we'll be the lead agency. I'll supervise the staff. We'll do it all. You know, that's not really how it works. They would essentially, those counties would sign MOUs, signing their funding over to us, but the three of us would still be working in partnership to be sure that the program was working well in all three counties.
I assume this is for the elderly and the disabled?
Correct. Yep. So the same, it'll fit the same population that the ADRC has now, which is why the state decided to make it an ADRC grant, because it's our same folks, 18 and older with a disability, or an elder, which the state defines as 60 years and older, that has a functional, some sort of a need. They don't necessarily have to have a diagnosed disability, but they need to have some sort of a, what they call a functional need. I usually talk, when I'm trying to describe what a functional need is, some sort of assistance with an activity of daily living, like dressing. But again, they're being even more flexible of how they're defining functional needs for this program than they are for the family care program.
So when would this start? If you get the grant, when does it start?
Quickly. They're making the decision by the end of February, and then the enrollment period would actually be July of this year through the end of the year, I believe. Technically, the grant is a 2-year funded grant. The grant would start in March of 2023 and would go through March of 2025. It would end, but that's because part of the grant program is also doing follow-up to make sure those participants are still doing okay, offering other outreach and services if they're needing more help or more services after the grant is completed and the funding has been spent.
How do you plan on getting this information out to the public if you
So-
do get the grant?
Yep. So that is another piece of the grant, which was super interesting and will probably be even more interesting to the supervisors. Besides the $7,200 per enrollment slot or per person that the person will be entitled to, the state is also giving the agency that gets the grant $703 per slot for administrative costs. So that should fully fund the positions, the staff positions that they want. And also part of the grant application that we wrote, part of that administrative funding will go towards marketing the program. We also already partner with so many folks in the community, the hospitals, the Veterans Association. You know, we already actually kind of I have a running list of people that we would like this program for, just those folks that we know, like, my gosh, they're not qualified for family care, but they just need this little bit of extra help. And it would, you know, the state has been clear we can do outreach to those folks and go back. It'll be really just a lot of communicating with the partners that already make referrals to us about what this program is and who would be appropriate. And then we also have, we'll have some funding to do advertising and outreach to the community to make people aware of it. And the state has said that they will actually help us by providing some marketing materials that we can kind of utilize but change to say, you know, contact Dunn County or whatever, but they will put some money into the marketing of it as well.
Do you work with hospice?
Yes, many hospice agencies. So those folks, you know, basically any of our partners, if we are granted, I would like to have like a big informational type webinar and just say, please join this so that we can explain this and then record it and allow, you know, have it available for folks to watch later, just to get the word out. Because really the state, there is a defined period for people to be able to sign up for the program. And I don't think we're going to have trouble filling those 320 slots, but if we can't fill them, that money just gets returned to the state. And then there may be a period of time where they redistribute funds that weren't used. So there could be kind of a second round where there are more slots open. And the state made it very clear they want us to keep waiting lists too, because they want that data when they're reporting back to the federal government. You're like, okay, these are how many people we serve, but if we had had full funding, we could have served this many more. But if we do have a waiting list and then money is redistributed, then we'll kind of have a list to go off of to continue to serve above and beyond that 320.
I was wondering, is some of our budget, which we will no doubtedly get, is some of our budget going to be used for data collection on what measures of success you'd identified?
We will, yes. The state, although they haven't defined very well in the webinar, they haven't told us what they're expecting for reporting from us. They haven't told us what format we'll have to use, but that was very clear. There will be some significant data collection that we will have to do and all of us, I'm sure anyone who's granted will be very willing to do that because I think this is a really worthwhile project and something we would all want to see continued.
Thank you.
I was thinking that if you wanted to, for instance, in the fall, do a program on the services that you have here and include that as something, so, for the programs maybe starting in September. And that would be a good way of getting information out and maybe somebody doing a program on the total services that you do, but focus in on that.
I'd be more than willing to do that, Margie. As you guys know, I don't have trouble talking. Yes. And again, just getting the word out, just both in general about what the ADRC does. And then even if we're not successful on being granted the grant, if we are, that would be, I hope that we would be able to talk about it. But even if we're not, just to give information of some interesting projects that are going on across the state and things to keep your eye on. Yeah. I'd be more than willing. Margie, maybe we can connect. I can email you about who I would contact to offer that.
Wow, talk about exciting news. I mean,
No, it is
all you have to know is
exciting.
just one person that you've known over the years, or you know now, that has had to, say, leave the healthcare center and move back home. The list of things that they have to do just to function and to stay in their house is just amazing.
And not everybody just has the expendable funds to pay for
No,
those
you really don't.
things.
I mean,
Yeah.
that's,
So it's very exciting. And like I said, I'm very hopeful that we will be granted, but even if not, I am going to be positive and, like I said, very closely follow that pilot in the hopes that it would expand after that initial pilot project. So even if
excellent.
we wouldn't get it right away, it might be something that would be coming up for Dunn County. So
Right.
Are other states doing this?
no, not that I'm aware of. And actually Wisconsin surprised, a lot of people are surprised. Wisconsin is very, very progressive in its use of Medicaid dollars. Wisconsin was the first state. Wisconsin developed the ADRC model and movement in that direction. And many other states have utilized Wisconsin as a model to watch. But this is not something that is that any other states are replicating at this point. But I wouldn't be surprised because they tend to watch what we do, especially if it's successful.
We don't want you moving to Chicago and fixing.
Oh,
it all.
I have no desire to
Okay,
move to
good.
Chicago whatsoever.
Well, Wisconsin hasn't hasn't accepted the rest of the Medicaid dollars. And so in a way, we have had, it's been a disadvantage in that some people would have been eligible for
Right.
funding through Medicaid that are not eligible now. And because of the state legislature's decisions. And I think that some of these people might be eligible under this. And anyway, I just want to mention that, Wisconsin's been progressive in some ways, but in some ways it hasn't been
Not.
very progressive.
I think that's a point well taken, Margie, for sure. Yep.
Well, I guess it's our responsibility to push through things that we think are really important.
Say something to the legislative committee.
Yeah, I think they got a meeting coming up.
Oh,
I don't know when for sure.
it's upcoming anyway.
It's coming up. Well, super duper. Golly.
And then Larry, I do have a second part of my staff
Oh, yeah,
report.
there you
This
are,
adult
protective
protective services report. So This is something that I plan to give to this committee at least annually and maybe twice a year moving forward. Adult Protective Services, or what we call APS in Human Services, is kind of a unique little department, and it's in different counties. It's kind of managed under different areas. Budgetarily, APS has always fallen under how does did she refer to it? Adult aging population type funding in the budget. But it's not always been supervised under the ADRC. Sarah Olinger was the ADRC director prior to Lonnie. And when Sarah Olinger was the ADRC director, she supervised APS. When Lonnie, my predecessor, took over as the ADRC manager, she was uncomfortable supervising APS because her background was as a registered nurse, not in social work. And the decisions related to APS typically fall in a social work realm. So Sarah agreed to continue supervising the APS area. And so it kind of started falling under behavioral health, which was the area that Sarah moved into. When I was hired, Sarah's programming in the behavioral health area was it's incredibly busy there, and she was starting to lack capacity to continue to supervise APS. So when they were hiring to replace Lonnie, they specifically were hiring for both somebody who could manage ADRC and APS. That's how it was described to me when I interviewed for the position. And I am a social worker, so I was okay with taking that over. So APS serves, again, the same population as ADRC, adults who are 18 and older with a disability or are considered a vulnerable adult, and elders. So again, the age 60 and up population. And they do kind of a number of different things. Their primary requirement, and the requirement by the state for counties, is we have to provide an area that investigates allegations of abuse or neglect against those adults with disabilities, vulnerable adults, and elders. So in Dunn County, we have 2 APS social workers, Ashley Williams and Kelly Bean, very experienced. Ashley has been an APS social worker for 7 years, but she's been a social worker. Prior to that, she worked in child protection, and she's been with the county for almost 15 years. Kelly's been an APS social worker with us for 4 years. So great small group of folks. The other piece, another large piece of what happens in a lot of these investigations is that APS gets involved with guardianship cases for adults who are vulnerable and unable to make their own decisions and need court intervention and assignment of a guardian. So we're involved with that piece too. The reason that I wanted to kind of just have a little report and a discussion with this group is because there's never been a really good place that anything about APS has ever been reported before, because it's kind of been shifted all over, and it doesn't really fit. In other counties, APS, it's all over the place. It can be directly it's very rarely, in very large counties, it can be its own kind of division. Like I'm sure Dane County has its own, and I'm sure Milwaukee County has its own APS. But in small counties, in most counties around here, it's part of aging, it's part of ADRC, it's part of behavioral health, it's even part of one investigative unit with children's. It's kind of thrown all over the place. And APS actually has a very small amount of statutes that we have to follow. It's kind of a neglected piece of area that the state oversees as well, in terms of guidance about how we do things in APS, which gives a lot of leeway for different counties to interpret things differently. But there is some movement to try to get, rarely does anybody want more legislation from the state, but APS is actually for years has requested more guidance and more information on how these cases should be handled. But I wanted to be able to report to you guys, just so that there's record that we're talking about APS, that some folks know what's going on in APS. APS is becoming, I would say, a more challenging environment. than ever before. And I would suspect that those challenges will only continue to grow. We have 2 full-time social workers. I kind of just have a couple little numbers. In 2021, we had 204 cases of elder abuse or neglect made to Dunn County. Last year, that increased to 268. And those numbers, that's kind of been like back in 2017, the number was at 188. So numbers continue to rise, and the cases are becoming much more complex. We have much more intersection with folks. We have a lot more partnering. We're working a lot more with behavioral health in terms of folks who have maybe features of dementia, but also significant mental health issues that take up a huge amount of resources from both of our areas, where we have to partner together to figure out the best way to serve those folks. Many more people that have no family supports. I think in the past, there were a lot more family involvement in terms of caring for folks, and there's just not that level of family support for some people now. Many more people who are just kind of on their own, needing assistance. And, we get many reports from the police. They get called to do a welfare check on somebody, and the person is really quite confused and just hasn't been connected up with services, maybe hasn't gone to the doctor for several years for a doctor to notice that their cognitive abilities have declined. So a lot more resources are needed, a lot more time is needed for each of those cases. So I would foresee that it's a likely within, probably not the all too distant future, that we will need to add an additional worker to APS just because of that need. Our goal is always to, when a case is screened in for services, when we receive the case, I'm the one who makes the decision if it meets the requirements of an APS investigation. And if it does, our goal is to try to make our first contact no later than 5 days after I've screened it in for services. But unfortunately, we really have not been always able to meet that goal, simply because I have 2 workers that serve the entire county, and sometimes they're involved in a case that just is more dire, and it's taking up all of their time for an entire week. So, some of those cases aren't seen as quickly as we would like. And of course, that just adds to potential increased danger for those folks when we're not getting out there as quickly as we would like. I still think we do a great job. We certainly probably serve people a lot faster than many of the other counties around us. All the counties, there's a kind of a regional APS group that I'm part of. They're all having the same types of experiences, more complex cases, numbers increasing very much. But I just wanted to make this group aware that there are certainly challenges in that area, and I would anticipate those challenges to do nothing but grow. So that is concerning. One positive thing, though, that I don't ever like to leave things on a negative note. We did partner with the State Department of Justice this past year in APS and got a very large grant. The DOJ actually got the grant, but Dunn County is one of the counties participating, in which we will be trained to provide more extensive training to our law enforcement professionals, financial institutions. This is a partnership between us and actually the Bridge to Hope, which is our domestic violence and sexual assault awareness, because they get involved quite a bit with cases of elder abuse as well. But this grant will actually provide them an additional staff person to be a specific elder abuse advocate. So that's really exciting. So Kelly and Ashley, my 2 APS workers, will be participating in a Train the Trainer event, and both Chief Atkinson from the city of Menominee and Sheriff Bigg from Dunn County Sheriff's Office had to sign an agreement that they would have at least 80% of their officers go through this training. And not only were they super supportive, they said, not only do we want this, grant, because I had I had a meeting with all of them to make sure that they were supportive of going through and willing to participate. They said, not only do we need this training, but we want this training, and we want 100% of our officers to be trained in this. We'll also be inviting all of the municipality, so Colfax, Boyceville, Elk Mound, they can all participate in that training. They were not required to be part of the MOU because there's, 1 to 2 officer units, but they will absolutely be able to have that training provided to them for free. So we're excited about that, but again, it's kind of taking on another task in my APS unit. But we made the decision as a team to go forward with that grant application. And even though it's more work, we all agreed that it's really, really needed. And it will only increase the ability for our departments to kind of work together, police and APS, to understand each other better and to investigate these sorts of crimes more in partnerships. And that will really, I think, only benefit those that are affected and victims of abuse in our county.
You already have the grant money for
Yes,
this?
and that was
Okay.
another thing. I'm like, we have some great news. We're part of this grant and nobody knows about it
And
except for
y-
Human Services.
You're
So
hiring a trainer then?
no, actually, so my staff, myself and Ashley and Kelly, the 2 APS workers, we will be trained to train the trainers. And
Okay.
actually, one of the sheriff's officers will be trained, one of the Menominee police officers will be trained, one of the advocates from the Bridge to Hope will also be trained. Part of the grant is that one of our judges actually is able to go. I always think it's funny. So for our APS little group and police officers, they're going to do a training for us either in Eau Claire or maybe the Wisconsin Dells. The judges, they have a 4-day training and they will be able to go to San Diego and get to stay at what I understand is a very, very swanky hotel, all expenses paid. That's not required. That piece wasn't required, but the judicial branch seemed very interested in participating in that. And then one of our DA office folks will also participate and also gets to go to San Diego. So those of us who actually will be doing all the training get to go to Eau Claire. And these folks, although I'm so happy because apparently that's really useful and good information for the judges and the prosecutor's offices to have as well.
I am very, very thankful and excited about this. I used to be an executive director of the Bridge to Hope over 10 years ago. And we had serious, serious issues and problems with the police department and the sheriff's department. And we had meetings with them. So I know this is really needed and I am so excited.
And we are so the Department of Justice actually received this grant 4 years ago, and they worked with another group of counties on the eastern side of the state. So this isn't the first time that the DOJ has received the grant, but those projects have finished and that training, the training that they were doing has been completed. And Mike Austin is the name of the DOJ person who wrote for this grant. He was actually contacted by this federal agency and said, we like the Wisconsin project so much. Why don't you consider doing it again, but reaching out to the western side of the state? So he kind of set out an all, interest type thing for any APS department to express interest and learn about it. Quite a few expressed interest and are interested in doing it, but the counties that actually are going to participate are ourselves, La Crosse, and Pierce County in this region. And then he ended up adding in Waukesha County on the other side of the state too, but they are all actually independent projects. It's just, those are the counties that were willing to do the work to get that funding.
Did you say St. Croix or?
Not St. Croix, La Crosse,
Pierce?
Dunn, and Pierce
Pierce.
are the 3 counties in our area.
And this is very important because many times the Bridge to Hope has to work with those other
Right,
counties
yep,
to protect
Yep.
the people that they're helping.
yep. So we are very excited, and we also saw a need to have better understanding with our law enforcement agencies too. And we feel like this will be a really great way for us to partner with them and for officers to kind of understand what the APS role is, what their role is, and just everybody always needs more education. Again, all of that will be fully funded by the grant. There's no expectation of any county levy or anything towards that, so.
I have a question. You mentioned that a lot of families don't have any support. You know, that you're finding that that's a number of the people that, okay. So you have someone that has some needs, but they financially don't fit with being able to get a support, a social worker or someone to work with them and be with them a support. Right now, we don't have, I don't think, maybe you know of some agencies or someone that does social work management for somebody that would be in this situation that needs ongoing support and somebody to help manage the situation.
So there aren't any like private case
Yes.
management organizations. There just aren't, which is unfortunate.
And they have financial, you have to
Right.
meet a certain financial
Right.
level before you get any help.
Right.
So who helps these people?
Right. Well, basically what happens is we can provide information to them about resources in the community and do some follow-up with them, but we can't case manage their lives forever. Sometimes folks, if they meet the requirements of guardianship, that they truly need a lot of assistance and they have some competency issues, and they don't have family, there are agencies out there that are called corporate guardians. And so actually those guardians charge a fee, a monthly fee, but they help manage their healthcare needs. They manage their finances. If the person ends up, spending their assets down to be eligible for Medicaid, that guardian would do that. But again, those are folks that typically have some dementia or some other cognitive issue that they can't make their own decisions for themselves anymore.
Well, it sounds as though that there's a market for a private social work agency or something in the area that would actually manage and help families in this area.
I think there certainly could be, Margie. It would
I mean,
be
and it may
finding
be,
the right folks to do that.
well, it may be that some of these people might fit into this grant
Yes,
that you're getting,
Exactly. Yep.
we're hopefully getting,
Right.
and might be able to be eligible for something, but there's a lot that, I mean, you may have people that have quite a bit of money in this community
Right.
that are having, would fit under this adult protective services because they can't, they really have no family support
Mhm.
and they need help in managing what
Right.
decision-making and whatever is going on.
Kind of
And-
navigating systems and that sort of
Right.
thing can be a challenge too.
I know other communities, I know we've had parents in other parts of the country that we've gotten social work, management, because they have some agencies or some private management there and you end up privately paying for it, but we just need something like that in this area. I mean, even if it's regional,
Mhm.
I mean, maybe a Lutheran Social Services or
Sure.
something like that, that would be able to privately manage and then people pay for it or family members pay for it at a distance. Anyway, I just think that's a need in our area and I
Mhm.
just wanted to know. Okay.
There isn't, Margie, that I'm aware of. And I think you brought that up one other time. And to be sure, I kind of double checked and I reached out to some of my the ADRC managers in other areas just to be sure there wasn't a service that I wasn't aware of. And several of them had said, years ago, there were things like that we could access, but there hasn't been one for quite some time in this region.
Unless you become a guardian and
Yes.
then give up your decision-making powers.
Correct. Yeah.
Okay.
That's all that I had on that. And like I said, that I do intend for that to be kind of a regular reporting type of, the next time I probably will have one of the APS workers come and just give a little presentation on the types of work that they do, just so that you guys have some more understanding of that. But very, very important services. But like I said, very, very small little area, but definitely growing need in that.
Wow. talk about covering the stuff. I
Yes.
mean, I never heard of adult protective services before myself.
Well,
But, I was thinking as doing it, what reporting agencies were, for protective services. And I was just, first one that popped in my mind was, kids, have got all this contact with schools and regular organization. And you could have an adult out there that no one would talk to hardly for,
Right. We get,
for a month.
right. We get a lot of referrals from the medical system for
Yeah.
adults, but folks can choose to go to their appointments or not. And I mean, if somebody doesn't show up for a medical appointment, there's a little bit of follow-up that they might do, but
Not much.
oftentimes not much. So there are folks that are definitely missed. And then by the time we get involved, things can be quite dire. So we see some definitely sad situations.
so that brings up my next question. You're saying that it's so dire by the time it comes to your attention for private citizens who see things. How well are we protected if we report some of
So,
these things?
Reports can be made confidentially. And the way they're made is actually you call the report system is done through the ADRC. So you call the ADRC, you let them know that you want to make an adult protection or APS report, or you can just kind of explain the situation and they'll get you to the intake worker. And then the intake worker takes basic information. We ask that people give us contact information in case the worker needs some follow-up, but people don't have to. And sometimes people choose not to. And then again, I review all of those reports and make decisions whether they are going to be investigated or not. But people can make anonymous reports if they choose to. We encourage people, if at all possible, can you give us the information? Just because many times there are follow-up questions from that initial review that we need some follow-up info, but folks do not have to do that.
Do you get, just for curiosity, do you ever get information from like utilities where, let's say aren't paid and
Yes.
maybe somebody ought to be
We
seeing what's
just
going on?
actually had an interesting, my first, and I've only been doing this for about a year, but my first case where somebody from municipal water utility company contacted us and said, I'm just concerned about this person because they don't seem to be using their water.
Oh,
Like
my.
they actually noticed that like they had water service hooked up, but they weren't using it. And so we opened a case just to see like, is this person okay? And what's going on with their water? And yeah, it was, again, that was the first time I've had a situation exactly like that happen. But yeah, we have, or, with the heat stuff, if somebody hasn't paid their bill and stuff, that's actually not uncommon, as many of you know, and there's heat assistance for stuff like that. But there are times that we get referred for that because especially sometimes that if somebody has had a pattern of paying their bill regularly and suddenly they stop, that can be an indicator that they're having some difficulty managing money and they might be starting to have some cognitive issues or memory issues and are not remembering to pay their bill or not able to do that anymore.
I know people that would remember the dog's appointment at the veterinarian better than they would remember their own.
Yeah, that's definitely the case.
Nobody in particular, just
Yeah.
the way it goes.
Oh,
Okay. Love my dog
Yes.
and she loves me.
Well, that's good.
Well, Luke. Anybody have anything else? This has been really informative. Well, then I can just call the meeting adjourned. And thank you, everybody, for coming, and we'll see you again on that nice day in March.
Yes.
right.
Hopefully good weather and good news. Yes.